my radiation portion of my chemotherapy in La Jolla scripts, and after the hardcore stuff at St. Joseph's, which was the chemotherapy, I had gone and had it done there, and my treatment was every day just on the leg, so I was lucky enough not to get headaches, not to get some of the other side effects, but I had severe burns on the under portion of my leg as well as the top part, and it wasn't just like a sunburn. It was so bad of a burn that they called it second-degree burns, and they had to give me special creams, and because it was in the crease, couldn't walk, and it was just not pretty. So I know there's a lot of not so good things that happen, but there's also so many wonderful things. Thank God for radiation therapy and chemotherapy, because while I was going through it, I was just hating every minute of it. But now, if it wasn't for that, when I look back, I'm just so grateful, to have had that as something that I wanted to mention. But Jim, can you tell us a little bit about more about what you do? And I feel like you haven't gotten a chance to.
Well, sure. As you were asked the question to Dr. Hart, what are some of the myths and what are some of the challenges that you've talked about? And one of the, I think, challenges in support services is to recognize that, one, there's the treatment of the disease, but there's also the treatment of the whole person, the whole patient. And let's look at the bigger picture. How is the person affected? How's the family affected? People's employment, their finances, their ability to deal day-to-day, moment-to-moment with possibly anxiety, depression, fear, and those kind of things. So the challenge becomes, I think, in my position in our support services, is to see, recognize, and honor each individual and the path that they are on. Not everybody reacts the same way to a cancer diagnosis. Not everybody wants the same thing when they're diagnosed with cancer. Some people, the cancer diagnosis is a nightmare. And maybe part of our job is to help them wake up from the nightmare and try to get some control over what's going on. For some folks, we see a lot of patients, the cancer diagnosis is merely a bump in the road. They want to get some clinical information, let the doctor take care of them, and get on with their life. Great, and if that's somebody's path, then we honor that. We have people who see the cancer diagnosis as a spiritual awakening, so to speak, and a redefining of who they are, and smelling the flowers for the first time, and looking at the sunset, and honoring the day, and really it becomes a spiritual path. So through programs and services, we can't cookie cutter anything or cookie cutter any response to an individual. We need to know who this person is. And as a medical center, as a service that we provide through St. Joseph's Cancer Center, I believe strongly that it's our role to honor that person's path. Not to change it, not to cookie cutter, not to tell somebody they need to get more information, because some people don't want that. And so to honor folks. I think that's probably the biggest challenge, and what makes my job exciting and different day to day, because each person I say hello to really have to hone in, have the antenna up, and use the skills to find out what does this person truly want. Because
everyone is different.
Absolutely.
There's a different story and different things that are going on. My first encounter, I remember, besides being able to use your computer, which was wonderful in the Cancer Center, you also had a whole variety of resources, books, and people that were just great also. But I was really interested in some of the books that you had, and I remember asking you, not only there were some on tape as well, there were some books, there were so many things, and one of the books that you had there was very special. It was beautiful poems, beautiful inspirational pictures, really moving type stuff, and I tend to be very emotional, and so I remember looking at that going, oh my God, and it really touched me, and you brought a book over to me. I think it was actually at the clinic, and it was just so nice of you, because you went out of your way, and that was just really sweet of you. I remember that. So for every individual person, I'm sure you've gone and done stuff like that. I mean, everyone has different, you have a billion patients that you're dealing with, I'm sure. You have a busy day, so I appreciated that, and that was really, really sweet that you went and did that. Are there any things about either of your jobs that you really, not a complaint necessarily, but something that we can help you in some way? Is there something that the people don't know about? There's something that you would like us to know about your job, something to make it easier for you, something to make it more, I don't know, is there anything that, is there anything that, not a complaint about your work, but more of a something that we can improve upon? Is there anything that we can do to help in any way? I know you're just really busy, and I don't know if I'm clear with my question.
I'm not sure, but I have an answer. But I don't know what answers your question. And that is, you said, is there anything we can help with? We being who? SJTV in this little slot. And if that's the case, it's important to us, to St. Joseph's, that the fact that we are a Catholic not-for-profit hospital, we provide services to anybody who walks through our door. And so all of our support services, which I can outline some of those if you'd like at some point, they're available to anybody. It doesn't matter where you're getting your cancer care. It doesn't matter where you're getting your treatment. If you're out of the county or you're a Kaiser patient or a St. Joe's, it doesn't matter. When it comes to our programs, our support groups, we do a retreat for families dealing with cancer. We do many, many programs. They're available to anybody in the community.
Okay,
So the biggest help you can be to me, to us, is to reinforce that. So folks don't, it's not just St. Joseph's, it's St. Joseph's providing to the community.
Well, I don't think that's something that they actually might have known. Can you elaborate on some of the points, some of that you said you might outline, some of the things that you guys offer that a lot of us are not aware of?
Sure. A couple of things. Standard to any regional cancer center would be a host of support groups, of which we have 5 that meet on a regular basis at our medical center, including a Spanish-speaking support group, breast cancer support group, laryngectomy group, a general group, and a group that discusses complementary and alternative medicines. We also do a retreat called Weekend Weekend. It's unique to the Central Valley of California. Nobody else does it. I was going to say that it uses quite a bit of resources. It's not inexpensive. It's expensive for us to put on this retreat, but we do it because we know it makes a difference in people's lives. And every October, we bring up anywhere from 15 to 25 families dealing with cancer up to the foothills. And we will have physicians and pharmacists with us.
Wow.
We will have social workers and massage therapists providing massage. We will have volunteers. We'll have a kids program. We will have marshmallows. We will have guitars, and we will have Kleenex.
Aww.
And we do camp for a day and a half.
That's wonderful. How do you? Which families get involved? Is it through St. Joseph's?
It's through the contact is through St. Joseph's, but we've had people from Sacramento, from Fresno. We've had patients from Discovery Bay.
Wow.
Many areas come onto this retreat when they hear about it.
What
It's a very unique
thing.
program.
That's beautiful. Is that something you've ever been to, Dr. Hart?
Yeah, early on I did for I think about 2-3 of the programs I would go up. And it was wonderful. It really was. The families were just there to support each other. That's what I loved about it.
Yeah.
And they would work with me, and we would talk together, and it was a good experience for not only the families, I would say without a doubt, but actually for the medical caretakers who decided to participate in the weekend itself.
It's an opportunity for the staff to see you, the patient, who we typically see in the medical center, in the acute environment, the person who's dependent and has many medical needs, to see them with their families, to see them as the whole person, and to relate in that very special way.
Right.
And what people usually feed back to us about the retreat, they appreciate the fact that we have relaxation groups, and we have support groups, we have clinical expertise, and we have these programs. But the strength of the retreat is families, patients getting together, being able to take a walk and just be real with one another and making those connections.
That's wonderful. How many years have they been doing this
We've
for?
done it for 13 years. It's the second weekend of October. May I give a phone number?
Absolutely.
467-6560. 467-6560.
And ask for you?
That's the main number to St. Joseph's Cancer Center. My name is Jim Linderman. Ask for me, and I'm happy to give more information about that, send you out a packet of information so you can make an informed decision if you want to get involved. We can also put you on our mailing list. We have a quarterly publication that goes out that informs the community of all kinds of cancer and health-related programs that go on in our community, and be happy to put you on a mailing list and give information.
I think that a big point of why I'm having Dr. Hart and Jim Linderman here today also is because there's so many of us out there that don't know that all of these things are available to us. Whether, I mean, I know that I had gone through that ordeal and didn't know half of what was available. And I know that the support groups and so many things, people think it's just you get cancer, you got to get your treatment, and then, but there's so much that goes into each and every person and each and everything that we go through that I think that it's very important to know that there's so much out there for us that doesn't necessarily cost us a lot of money if you can't afford it. That doesn't necessarily, there's so many resources that many of us that don't realize that are available to us. So I think it's a great thing.
Even that library that you mentioned when you were at the hospital, that's available to anyone in the community. We have over 80 videotapes, 300 books. We try to keep current a lot of clinical information on nutrition, alternative medicine. You mentioned poetry, speaking to the soul and the spirit, a whole myriad of things. Anyone's welcome to come in and browse. If you want to take something home, we give you a little library card. and we take care of business.
So do they get to keep it for a week, or is it a day? Is it
It's a 2-week on the books. It's a 2-week checkout on the tapes and the videos. It's a 1-week checkout.
That's
No,
great.
no charge.
That's important. That's wonderful. And is there anything else? I feel that you guys are contributing in a major way to cancer and health and wellness. And is there anything that not only SJTV can do, but I mean, I feel that how can people help themselves basically, and thereby help you reach your maximum efficiency to perform your jobs? I mean, is there anything that we can do as well?
Oh, definitely. I always involve my patients in their care. If they don't help me, I can't help them. Sometimes I have a patient that comes in and tells me, "Doctor, I'm in your hands," and I look at him and say, "Oh, no, you're not. You're in both of our hands. I need your help."
Right.
And so when the patients can help me help them, that's when we can both be as successful as possible. This is as simple as eating. Sometimes the medications, the radiation treatments, the cancer itself can interfere with a person's appetite. They just don't want to eat, and it becomes difficult. But if they can do that simple thing of nutritionally keeping themselves as sound as possible no matter what, that is like one of the major therapies involved in their care. And so it's simple things like that. One thing is showing up for treatments. This is always nice.
People sometimes don't come.
Sometimes we try to tell them, but it is important to come into for treatments as they are planned.
Right. You can't skip those doses.
No, you
it's
can't
not like
skip
taking
those
Farago.
doses. So when you can do that, we appreciate it. I have a wonderful staff at the medical center and in the cancer center. They're extremely supportive. They really watch over the patients. I call them my patient advocates. I think the staff, as far as they're concerned, the doctors are kind of on the low rung.